Welcome everyone to tonight's webinar, How to Navigate Menopause with Integrative Medicine. Tonight we're speaking with Dr. Alexandra Smith, who works at Nirvana Health Clinic here in Calgary. Yeah, so all about menopause. I feel like we can't talk about menopause without first talking about perimenopause.
Totally. Yeah.
That might be a good place to start.
It might be a good place to start. Yeah, it might be a good place to start just to kind of define what perimenopause and menopause are. So with perimenopause, this is kind of that time of big hormone fluctuations that are happening. So this is where the ovaries are essentially at almost their final reserve of having eggs left to ovulate. And so we can get big fluctuations in our hormones. And so generally periods are quite erratic, and then women can start to feel different signs and symptoms of those kind of menopausal symptoms: night sweats, brain fog, mood changes. Heavy bleeding is really, really common in this stage. And this is kind of that last year to 6 months that women are having fluctuating hormones. And then once we move into menopause is actually diagnosed once you haven't had a period for an entire year. And this is where we see estrogen and progesterone and testosterone a bit really start to drop off, and those levels stay really, really low kind of for the rest of your life. So our ovaries primarily produce our estrogen, progesterone, and testosterone. And so when they're no longer producing those, because we're not ovulating anymore as women, we really start to see those hormones tank, and then we can see symptoms associated with that.
Yeah. So just going into more detail about the symptoms, like for menstrual changes, what does that typically look like? For cycles other than heavy bleeding? Is it like duration, things like that?
Totally. So in perimenopause, duration either shortens, so women can experience periods every 3 weeks, every 2 weeks, or we might see really, really long time between periods. So if you get your period every 6 months, you might think, oh, I'm kind of getting closer to that menopausal stage, and then a woman will happen to get her period. And that still keeps you in that perimenopausal category. So different for everyone in terms of what they experience, but the majority of women experience shorter length between cycles to start in that perimenopause stage, and will generally see increase in bleeding. And then it'll slowly start to widen out, essentially. And then there might be some spotting or really, really light bleeding between a full period, as the body is really kind of stopping producing these hormones. And so we're stopping to build that uterine lining that we shed monthly when we are menstruating.
Right. And what kind of age range, I guess, does perimenopause fall into for most women?
So most women, it's typically around 50 that we start to see this. The average age in Canada for women that are going into menopause is 51. So some women will start to experience those perimenopausal symptoms years before they're actually into menopause, around 51. Others around that kind of 48 age range will start to experience that, and then will be in kind of full-blown menopause by their 50s.
Right. I guess as women are creeping up to menopause, are there things they can do before they hit menopause to help maybe mitigate some of those symptoms?
There's lots of things that we can do to help mitigate some of those symptoms. So big things that I like to focus on with my patients is we kind of prepare the body to go through that transitory stages, that we look at comprehensive testing to understand where hormones are at before even moving into a menopause stage, because then we can really start to prepare. Let's say that a woman has really, really high estrogen in comparison to her progesterone. We may want to work on first taking care of that even while they're still menstruating, right? To help decrease that estrogen so that it's coming back into normal ranges. And that kind of sets the body up so that there's not such a severe decrease or drop off in estrogen, which that can really be the reason that women experience such intense symptoms into menopause, which when you think about hot flashes as being one of the most common examples, what's happening with hot flashes is that the little receptor that's usually getting plugged with estrogen all the time is just sitting open. And so when that estrogen receptor is just sitting open, we start to experience these symptoms, and hot flashes is a really, really common one of that, where if we're reducing the amount of estrogen, if there's an overall dominance in estrogen, we're also reducing the reliance on how many receptors we might need. So the body kind of naturally starts to decrease these receptors, and that can be a much more smooth process if we don't have already super dominant estrogen, that we're then moving into this extreme deficiency, where these receptors, there's hundreds of thousands of them throughout the body, but that they're just sitting open and aren't being plugged anymore. Can I keep going?
Yeah.
Yeah, okay. There's lots of things that we can think about. I'm sure lots of people have heard of things like phytoestrogens, things that look like estrogen to help kind of mitigate some of the symptoms that drop off in estrogen can have. So where those receptors are sitting open, we can use things that look like estrogen that are called phytoestrogens that really loosely bind to the estrogen receptor to help decrease that symptom, but it doesn't promote the repeat production of these estrogen receptors again. So helps with symptom management, but we also allow the body to move into that menopause stage.
Mm-hmm. Yeah. Sorry, I just lost my train of thought. I was looking at the Q&A. I forgot to mention at the beginning, yeah, if you guys have questions, definitely type them in the Q&A or chat box, and we will leave some time at the end to get to those as well. Yeah, so just talking a little bit more about estrogen. So there's 3 types of estrogen, and so do those all kind of drop at the same time together, or what does that look like?
Yeah, so that's a really good question. We have 3 different types of estrogen, and when we're women that are cycling, meaning we're having a regular menstrual cycle, estradiol is the highest estrogen that we have. And then as we move into menopausal stages, we actually change what estrogen we rely on, and we rely more on estrone or E1. So we take the burden off of estradiol, which is the one that binds receptors the tightest, and we rely much more on that estrone. And then there's a 3rd type of estrogen called estriol, which estriol is really, really important for proliferation of tissues. So when we think about the risk of osteoporosis later on in life for women, or fracture risk, that estriol really helps to build the bone adequately when we're still menstruating. But that estrogen also drops off in menopause. And all 3 of them do. We just see much more reliance or secretion of that estrone once we're into menopause than estradiol.
Oh, okay. So I guess once women are in menopause, what are some things then that they should be doing or thinking about to help that period of their life?
Totally. So again, we still have estrogen receptors in different areas in the body. And one of the biggest risk factors once we no longer have high amounts of estrogen is our bone health. So osteoporosis risk goes up when we're no longer menstruating. Cardiovascular risk goes up as well. So we can, again, consume those phytoestrogens that look like estrogen that can significantly help to bind those receptors and allow those processes to happen properly. Which there's lots of different examples of what that means in terms of phytoestrogens. There seems to be 3 kind of big categories for the phytoestrogens. And the first one is the lignans, which that's primarily found in flax seeds. So flax seeds can be really, really helpful through this phase to be eating. You want to make sure that you're grinding those up. And if there was any excess estrogen, they actually help to bind excess estrogen and get it out of the body too. So they kind of have a counter intuitive action in the body, you could say, that they work to bind up excess estrogen in women who have too much, but they also help to bind that receptor as a phytoestrogen, which is really interesting that we have this kind of dual action with those flax seeds. The other category is isoflavones. Most people know this as soy, which soy can be quite controversial in terms of a lot of different research out there. You really want to be careful with soy. You don't want that to be your only sole option for a phytoestrogen. We never want to be eating too much of it. And we want to make sure that it's coming from an organic source, non-GMO. With soy in small amounts, it's a really, really powerful phytoestrogen, meaning it can significantly help with the symptoms in menopause and help to bind those estrogen receptors, but we just don't want to be overdoing it with that one. Other sources of isoflavones, kidney beans, chickpeas, mung beans, those can all be helpful to add into the diet if your gastrointestinal tract can tolerate it. And then the third category of phytoestrogens is coumestans, and those are found in alfalfa sprouts as well as clover sprouts, which that can again be another source of those phytoestrogens that can be really helpful for some of the hot flashes symptoms that women might experience in terms of just binding up that estrogen receptor.
Mm-hmm. I found vitamin E an interesting, I don't know if you use that. I know, like, I have tried that.
Mm-hmm.
It worked well for me. And I noticed when I stopped taking vitamin E, kind of my symptoms had come back. But yeah, is that commonly used for hot flashes in women in menopause as well?
Totally. And vitamin E has really good benefits if there is a risk for cardiovascular disease. Vitamin E also has positive effects there too. So that can be a really, really helpful one for symptoms of menopause as well, from more of a nutrient standpoint.
Yeah.
Yeah.
And just further talking about diet, would you also say that, maybe eating less meat and more vegetables, legumes, things like that, including those phytoestrogens, et cetera, would be kind of an overall beneficial diet for someone in menopause?
Yes. Now, we don't want to just kind of lump everyone in menopause into the same category, right? We can have other things that are important to consider in terms of dietary changes. But overall, plant-based diet, making sure that you're getting a diet rich in those isoflavones, but rich in different vegetables, super important, right? Really important for us to be able to get all of the nutrients that we need in order to build the different building blocks of our hormones, but also really important at helping us with detoxifying properly, which that's a huge one in menopause, that we want to make sure that our livers are functioning properly, and getting that diet rich in fruits and vegetables and more plant-based, we seem to be decreasing that inflammation as well as helping with that liver detoxification piece. One thing too, I mean, we've talked a lot about estrogen so far. Progesterone is another huge hormone that drops off in menopause, and that's because progesterone is produced by the small little capsule that's left behind when you ovulate. So that little capsule, if you're not ovulating anymore, is not being produced in the ovaries. So we're not producing our progesterone anymore. And the biggest symptom that women experience with low progesterone, sleep disturbances. So insomnia. A lot of women experience they can't fall asleep, they can't stay asleep, and then maybe they're having hot flashes or night sweats on top of that. So that's that estrogen piece, but then we also have to consider that progesterone has dropped off. And there's lots of things that we can get within the diet that can help with, again, being things that look like progesterone, which there's a few different kind of compounds that have been shown to have some progesterone effects. They have some pretty confusing names, but I'll just kind of name them off and then give some dietary recommendations. One is called apigenin. This is commonly found in chamomile tea, which chamomile tea is known to be quite a good sleep-inducing agent and an anxiolytic, meaning that it helps to decrease anxiety, which progesterone, because it can cross the blood-brain barrier, also helps to reduce anxiety. So that can be really, really helpful for some women. Narraginin, which is found in citrus fruits, specifically found on the outer rind of a lot of different fruits, does have an action on progesterone receptors as well. And then luteolin has some progesterogenic effects too, which we find in celery, parsley, broccoli, onion, carrot. So this is where your vegetable family really comes into play, because it's found in so many of our vegetables. So if you're eating a plant-based diet, you're getting lots of different variety within your vegetables, you're probably hitting that luteolin category quite well.
Awesome. Yeah, I guess with citrus fruits, the rind, you could just like grind some of the rind. Would you eat the whole? I've always wondered that. Like, I know just eating like a rind of like a lemon or quite bitter, but yeah, I guess are there easier ways to kind of incorporate that citrus fruit?
Totally. So even just grinding or grating some lemon zest into a salad dressing, same thing with orange zest into stir fry or something like that. That can be a really easy way to incorporate that, because like you said, eating a rind, super bitter and probably not that appetizing. But if you can grate them and get them kind of hidden in some salad dressings, they have really good flavor within that, as well as we're able to actually get them into the diet.
Awesome. Perfect. What about some things to avoid? Like caffeine, alcohol, things like that?
Yeah, so both of those can be really hard for women in menopause, which makes sense, right? If we're not secreting our hormones properly, and then we're drinking a bunch of caffeine that increases anxiety potentially, we can see that kind of exacerbated effect of anxiety. Same thing with if our estrogen is really, really low and we're adding in something that's quite warm and stimulating, that can actually trigger a hot flash for some women. So some women need to change over to decaf or need to cut coffee completely. Tea tends to be a bit more well tolerated. If you can move towards something like green tea that has a lot of anti-inflammatory effects, as well as some caffeine, but has some anxiolytic effects as well, meaning it does have some compounds like L-theanine that help to decrease anxiety. That can be a bit more tolerated for some women that are really noticing the mood fluctuations. With alcohol, red wine is probably the biggest one that women react to in menopause. It seems to increase those hot flashes, likely from an underlying inflammation perspective. What's interesting is that resveratrol, which is a compound that we find in red wine that gets a lot of tout for health benefits, does have polyphenols that look like estrogen. So it's interesting that there are some benefits within red wine, but if you can get those resveratrol polyphenols from something else, that's probably better than drinking alcohol, which can just be inflammatory towards the system. And then we're just perpetuating or exacerbating those side effects.
Yeah, for sure. What about like gluten and dairy? Yeah, they seem to be sensitivities for a lot of people, or they might not realize. Are those just kind of good to eliminate, especially if you're having a lot of symptoms, to maybe rule out those categories?
Totally. It can be helpful to try an elimination in that case, where we're putting less of our diet focus on gluten and dairy, reducing that. Those are some of the most common things that people react to when we have some kind of sensitivity within the diet. The big three seem to be gluten, dairy, sugar. So if we can reduce those, and then we're just reducing the overall burden on the body, right? When you take those big ones out of the diet, you've got to fill in with something, right? So focusing again on getting a variety of vegetables within your diet can be really, really helpful in order to help promote decreasing inflammation, helping with binding those receptors that are sitting open, and then helping with overall liver detoxification.
Right. And I guess for a lot of women who are struggling with symptoms, maybe they're, eating really clean and taking supplements and things like that, and they're not feeling better, what are some other things that might maybe then be going on, like underlying inflammation, or chronic inflammation, or something else? Is that something you see a lot of as well?
I do, yeah. So when women are in menopause, we love to blame all the symptoms on estrogen and progesterone, which it's
Mhm.
not always the case. And those might be totally fine, or we're supporting them. And so therefore they shouldn't be causing as much havoc as they are. A lot of these symptoms can actually be caused by the stress hormone cortisol. So hot flashes can be caused by cortisol, night sweats can be caused by cortisol. The abdominal weight gain that a lot of women experience in menopause can be caused by cortisol. And so we can sometimes put all the blame on our female hormones, and it's not really what's at play. It's that we're not making our stress hormone properly.
Mm.
So stress mitigation techniques throughout the menopausal time, meditation, making sure that you're exercising regularly, getting outside and getting exposed to the sun can be really, really important through this phase. And then of course, understanding or looking to see if there might be some underlying inflammation factors that are at play, or there's potentially something going on with gut health that's contributing to those symptoms, and that it's not solely the hormones alone that are the only ones that are causing this.
Right. Yeah, I feel like a lot of, even yeah, when I worked in the store, there was a lot of women that, yeah, were really struggling, and I felt like I could only do so much. But
Mhm.
yeah, further learning, and just there seems to be a lot of people, especially now and just how the world is, it's a stressful time. So that on top of everything else, it's, yeah, much harder to kind of
Yeah.
get those stress hormones under control. But yeah, I think doing proper testing, like you said, for all the hormones to really kind of get to the root cause instead of just guessing on some of this stuff is beneficial for sure.
Mhm. Yeah, it helps us really kind of piece together what might be contributing. And then we can really start to get targeted with supplementation or diet lifestyle factors, right?
Yeah.
Where you're really starting to target certain hormones once you see that there are imbalances. And it's really common that we have to treat from both areas, right? We treat the stress hormone, we also treat the female hormones, and those go hand in hand. And then same thing, if we're not breaking down these hormones properly through our liver and actually eliminating them appropriately, then we can start to see buildup of all the metabolites, and that further exacerbates these symptoms. So we want to make sure that we're breaking down those hormones properly, that gut health is okay, so that the body is a well-oiled machine.
Yeah, for sure. We do have a lot of questions coming in, which is great. Yeah, so maybe we'll just get into some of them now, and yeah, see where this takes us. So
Sure.
yeah, there's a few about libido and loss of sex drive. Yeah, any insight on that?
Yeah. So generally, where this low libido comes from once we've gone into menopause is testosterone, which is a hormone that we haven't really touched on yet. Testosterone, really important for women for motivation, sex drive, seem to be the two biggest ones. We don't want it too much, right? That can lead to acne and things like that. But this is something that also drops off in menopause and is not commonly looked at. So this is generally a part of a hormone assessment when you get a hormone or comprehensive hormone testing done to understand, okay, is testosterone the underlying reason that there's low libido or low sex drive? And that's a really, really common symptom from menopause, and testosterone is usually that big hormone for that one. On the other hand, there is a bit of understanding around estrogen with this as well, where if estrogen is really low, that's causing vaginal dryness, vaginal atrophy, which means that sex can be painful for women. You may be seeing lower libido from that angle too. So we want to make sure that we're addressing both sides of the hormones that can be related to low libido.
And is that where maybe like bioidentical hormones would be beneficial, or is it trying to raise kind of the testosterone naturally?
Yeah, so there's two different options, right? Bioidenticals can be really, really helpful for this, where we're just giving the body a bioidentical hormone that's no longer producing, and that binds those receptors and can bring that sex drive back online. That can be really, really helpful for some women. We can also work with different things within supplementation, different herbs that really help to increase testosterone naturally. So there's different options, and depending on the severity that comes up on testing, that's where we usually kind of make that decision in terms of, do we think that herbs and nutrients and diet are appropriate here, or do we need to consider a bioidentical?
Right. That made me just think of pine pollen. I know it's been just more popular lately for the testosterone piece. Is that something that's been clinically proven?
That is
That
a
it
good
has to.
question.
Okay.
I've definitely seen it be more popularized in just kind of blog posts and stuff like that.
Yeah.
But I haven't seen specific research on pine pollen and specific dosing.
Okay.
I've certainly seen pine pollen in different blends that boost your testosterone overall.
Right.
But that one specifically, I think we need a few more clinical trials to really understand kind of specific dosing around that.
Right. Okay.
Yeah.
Awesome. Yeah, I did see a few questions too about hot flashes. Just again, they've tried supplements and diets and all the things, and nothing has been working. So again, is that, yeah, some more underlying causes than just
Yeah.
female hormones?
Totally. So it could be related to that stress hormone, like we talked about. If cortisol hasn't been assessed, that's something that should be looked into, just to understand if that might be an underlying reason. Hot flashes and night sweats can come from other things too. So if there's an underlying chronic infection, we can sometimes see night sweats be really, really a big problem. And if we're kind of overlapping with menopause and there's also an underlying chronic infection, it can be hard to tease out exactly what's causing that. Another thing with hot flashes, making sure that your liver is detoxifying properly. If we have lots of toxins in the body and we're not able to move those toxins through, that can sometimes be a reason that we see an increase in that flush. And that's the body essentially detoxifying. If we start sweating, that's another one of our detoxification agents. So I do like to promote liver detoxification through hot flashes to help with that. Siberian rhubarb has a lot of really good research on it too, to help with hot flashes. So if that's something that hasn't been tried in terms of a herbal approach, that can be really, really helpful for some women.
Awesome. Yeah, and as well, so a few our participants or attendees were saying that they were taking or eating phytoestrogens, and it seems to be making things worse. Yeah, specifically flax seeds and soy. So is there any reason as to why that would be?
Potentially they're not breaking that down properly, so it's having the phytoestrogen effect, but we're not moving through liver detoxification properly, would be my first thing that I would want to focus on. Also, just how the body might be taking that out of the gastrointestinal tract. So with phytoestrogens like flaxseed, like soy, we do rely on the gastrointestinal tract to move it to a different kind of molecule that has a phenolic compound that binds the estrogen receptor. And if we don't do that properly, we might not be achieving the right effect with that. So that might be underlying gut health concerns too. Again, further investigation would help with that. We also want to focus on, with comprehensive testing, understanding how we're actually breaking down or metabolizing our estrogens. Because if we're not breaking them down properly, we can sometimes see phytoestrogens actually make the problem worse. And so we need to focus on breaking down those estrogens through the protective pathway. I think I talked on our last webinar about cruciferous vegetables being our biggest helper here. So that's your broccoli, cauliflower, Brussels sprout family. Rosemary can also be really, really helpful. And with those cruciferous vegetables, you want to make sure that they're cooked, not raw.
Right. I think last time too, we spoke a little bit about the genetic component you can do maybe all the right things and eat all, do everything correctly and clean, but genetically we might just be, or menopause might just be harder for us. Is that, yeah, that's probably, again, maybe why some of these women are struggling and thinking, well, I'm doing all these things right and nothing's improving. So is there a way to test that genetically, or is it just kind of rule everything out and then maybe that's what's going on?
Yeah, so there's a few different things that we can test. Looking at the way that the body is promoting estrogen breakdown can be huge for this. So we tend to break down our estrogens through 3 different pathways. One of those is protective and the other 2, not so much. They actually can lead to estrogen positive cancer later on in life. So understanding how you're breaking down your estrogens, if you're not promoting down the proper pathway, that can be a reason. If you're not able to methylate, that can be another thing, because we do rely on methylation from our B vitamins to actually take one of our estrogen metabolites, get it into the methyl form so that we can poop it out. So if we're not able to do that, that's something that we can look at with genetic testing to understand how that process is working, which can give us insights in terms of the backup of breaking down your estrogens properly.
Right. Okay.
Yeah.
Yes, this will be recorded, so everyone can go back and watch. So don't worry about if you miss anything. Someone's asking about eggs specifically.
About which?
Eggs.
Oh, about eggs.
Yeah. Would they be beneficial?
Yeah, so eggs aren't necessarily changing how they bind to receptors. They're not necessarily a phytoestrogen or a substance that increases progesterone, but eggs do have a lot of the building blocks to build our hormones. So what little we do produce in menopause, we do use cholesterol as the backbone for that. And eggs can be really, really helpful there. I do recommend for women who are eating eggs that they are free range and that they're organic, so that they're not pumped full of hormones or antibiotics, which can further disrupt our hormone regulation. So that's really, really important. And then just ruling out that there's not any kind of sensitivity. So if you notice that you get some GI upset when you do eat eggs, that's probably not something you should be eating in your diet. And there's other ways that we can get that cholesterol or healthy fats from.
For sure. So how do you test if it is cortisol that's causing the symptoms?
So we can test in 2 different ways to look at cortisol. With cortisol being our main stress hormone, this is something that I generally look at in the urine. So I get to see the breakdown products of your cortisol, and I get to look at it at 4 points throughout the day to understand how it's being secreted. We look at it in the morning where it's supposed to rise, and then it's kind of supposed to slowly peter out throughout the day and be nice and low at nighttime so that you can go to sleep. So testing it at 4 times, we get to see that nice big cortisol curve. The other option is looking at cortisol in the bloodstream, which generally we look at cortisol in the morning in the bloodstream. That's where we get that most accurate result of that rise in cortisol in the morning. And then we just make assumptions throughout the rest of the day in terms of how the cortisol is being secreted. We're not going to do a blood draw on you at 4 times throughout the day. That's quite invasive. So we take that morning cortisol and then we kind of make assumptions from there.
Awesome. What is your opinion of Estrovera? Not familiar with that. I was taking it for quite a while and then stopped and found I was quite moodier after stopping it. I've started taking it again and feel better.
So Estrovera, that's the Siberian rhubarb that I mentioned that can be a really, really helpful phytoestrogen and has really good research on it. Mood changes seem to be the symptom that was really helping for this particular person, but can also really significantly help with hot flashes, especially hot flashes at night. If women are experiencing that, I find Siberian rhubarb to be extremely effective for that. And that's where the majority of the research on Siberian rhubarb are.
Awesome. Yeah, I know some of there's like a day and night herbal supplement that we carry that has that rhubarb in it. Yeah, just for day and night symptoms of menopause. So
Totally.
So gut health, I have a friend who just started Restore Attacks and all her menopause symptoms went away. Thoughts?
Oh, that's interesting. So Restorelax, that is a laxative. It's a compound that essentially helps to draw water into the gastrointestinal tract so that we poop. So it's not a stimulating laxative. It is something that you can just buy over the counter. With that increase in elimination of your hormones, makes sense in terms of if there was a buildup in the liver and the liver wasn't breaking down things properly, and there were some toxins or inflammation that's potentially associated with those symptoms. Makes sense that once you get that part moving and you're eliminating those things properly, that some of these symptoms get better.
Yeah, for sure. I guess for something like that, you maybe wouldn't want to take that all the time. Just, yeah, I feel like
yeah,
dependent on that, but
totally. Yeah. Ultimately, you want to figure out kind of why you're maybe not going to the bathroom as often as you should be, or having a bowel movement every day, and then helping to restore that so that we don't have to rely on something like a laxative to induce that for us. That can be really helpful. But with knowing that it made some menopausal symptoms go away, it sounds like looking in the GI tract and kind of correcting that would be a good treatment plan.
Mm-hmm. For sure. What should our testosterone numbers be?
So this is a good question. When we look at testosterone in the bloodstream, we generally want to see testosterone between about 0.9 and 1.2. That's where we kind of get those optimal levels of testosterone, where we have that motivation, sex drive from our testosterone, but we're not seeing that low sex drive, low libido. When we go higher than that, we can get the negative side effects of having high testosterone, which acne is the most common symptom. Angry outbursts can be another one.
Thoughts on intermittent fasting being helpful or not?
This is a tough question because intermittent fasting is not for everyone. Intermittent fasting can be really, really helpful if we need to kind of give the GI tract a break where we're not constantly eating. It can also be really helpful for some people with weight loss. So if weight gain is a big concern, intermittent fasting can be helpful. You want to make sure in that eating window that you are getting lots of good fats, carbs, protein. So you're eating a well-balanced diet within that eating window. And then with intermittent fasting, I generally recommend eating breakfast and stopping eating earlier in the day, which can be hard for people. Most people skip breakfast and then they start eating around noon. They have that kind of 12 to 8 window. With that 12 to 8 window, we generally see a bit harder to regulate your blood sugar throughout the day. So the body does a much better job of regulating blood sugar earlier in the day. We are not very good later in the day, which if anybody is familiar with the afternoon snack where you can't stop eating, or the late night snacking, or you just feel super, super hungry, that's usually due to blood sugar regulation concerns. And we usually mitigate that with getting good protein in the morning. Good protein in the morning, super important for our stress hormone, cortisol, super important for us to make our female hormones too. So protein in the morning, maybe stopping eating a little bit earlier. Much better outcomes with intermittent fasting that way.
Yeah, absolutely. I feel like for women in general, they tend to be more sensitive. Mm-hmm. Men seem to get away with doing more, intermittent fasting, longer periods, but
yeah,
it's I know for myself too, when I tried that was not not a good thing. But I think like you said, just maybe you could try 10 or 12-hour window instead of eating, at 10 p.m. at night or 11 p.m. Just cutting that back a bit earlier, but eating in the morning, I would agree. Yeah.
And if we're not eating it. If you eat a lot at night, right before you go to bed, especially, that can be a huge part for sleep disturbances too. So if you're experiencing insomnia or sleep disturbances, that is something that you can try as well in terms of stopping that late night snacking, if that's part of your routine, moving more to that protein in the morning and helping with that blood sugar regulation throughout the day, because that could be another underlying reason that we're not sleeping.
Yeah. I've heard moringa or turmeric tea can really help during menopause. Is this correct?
So yes, both of those are really, really helpful for liver detoxification generally, and they're both anti-inflammatories, meaning that they decrease inflammation in the body, which can be helpful. We may not be getting to the doses that are necessarily in the research with a tea, but some people do notice a lot of benefits just from drinking tea throughout the day. And we're kind of helping with that liver detoxification as you're drinking a turmeric or a moringa tea. So definitely not a bad thing to add in or incorporate, and see if you notice changes with that.
Sure. How is the parathyroid connected to menopause? I have parathyroidism in menopause, had to have surgery to remove the gland.
With hyperparathyroidism, the parathyroid, that's a small gland that sits on either side of the thyroid. I'm not 100% sure how this is connected to menopause, but when we think about the fact that our estrogen and progesterone are no longer being produced, our pituitary gland, which is an area in the brain, has to start producing LH and FSH to essentially stimulate the ovaries to produce estrogen and progesterone. So we'll see a big rise in those hormones. Potentially with that increase in pressure from the pituitary, it increased some hormones that bind the parathyroid as well, because there's lots of different hormones that get released from the pituitary. Our thyroid stimulating hormone gets released from there, so potentially with an upregulation there, but I don't know of an exact correlation with menopause. So I'm sorry that I can't answer that question in full.
Heart palpitations, especially at bedtime.
So this could be related to that drop in progesterone. If we're feeling particularly anxious and that's inducing heart palpitations, that could potentially be connected. If you're noticing some changes in terms of insomnia being there as well, that's likely that low progesterone. So focusing on some of those progesterone things that we can add into the diet can be helpful. One thing that I haven't mentioned with progesterone is that progesterone crosses the blood-brain barrier. And so what progesterone can do is when it crosses the blood-brain barrier, it can increase something called GABA, which is a inhibitory neurotransmitter, kind of makes us feel super chill, relaxed, allows us to go to sleep. So when we see that big drop off in progesterone, we're no longer getting that action of increasing GABA. So potentially with adding in something like GABA or something that increases that neurotransmitter, that can be helpful at decreasing those heart palpitations. We also have to consider that estrogen is really important for the cardiovascular system, so it could be related to low estrogen as well. This is where testing comes in hand, because we want to kind of figure out, okay, what is that root cause, and what is the hormone that might be imbalanced that's leading to this. Stress can also be a huge thing for heart palpitations. So if it's some cortisol dysregulation or feeling stressed out before you're going to sleep, that might be another reason that you're experiencing some of those. Heart palpitations can be related to a lot of different things. So there can be some nutrient deficiencies there as well. So doing a comprehensive intake, understanding comprehensive testing and going through that can be really, really helpful to uncover kind of what's going on.
For sure. What about weightlifting? Can this increase testosterone naturally? And is it better than cardio during menopause?
Great question. I tend to like to have both exercise activities because they both have really, really good health benefits. But yes, testosterone can be increased by us putting on muscle mass. So testosterone not only helps us as women in the ability to put on muscle mass, but when we do weightlifting, we actually do increase our testosterone. So that is a good way through exercise to help with that.
So how do you create healthy cortisol levels? So you mentioned protein in the morning. What else?
Light exposure is probably the biggest one. And what I mean by light exposure is sunlight. So when you wake up in the morning, if you can get outside and get sunlight into your eyeballs, that can significantly help us to raise our cortisol properly. If you can get midday sun around noon outside on your skin, not to the point that you're burning or anything like that, but about 5 to 10 minutes outside with your skin exposed, we get great benefits of increasing our estrogen and testosterone. And then sunlight at sunset is really, really helpful at telling or teaching our bodies that, okay, it's time for us to wind down, time for us to go to bed. So that can be really, really helpful, which we call this the light exposure protocol, where we get that morning sun, midday sun, and evening sun. And then after the sun has set in the evening, if you can use lamps that are at eye level rather than overhead lighting, so not like I am in right now, but if you can use lamps at eye level, reduce the amount that you're looking at screens, that can be really, really helpful at decreasing those cortisol levels and getting us ready to go to bed.
Yeah, there's a great app called Circadian.
Yes.
Yeah, and so it tells you the sunrise, so like the UVA rise, as you were mentioning, to see the sun, get that UVA into the eyes. I just wanted to mention, like, I think contacts, I know I didn't know this after talking to Corey, but he's like, yeah, don't wear glasses, don't wear contacts. You need to look at the sun in just your eyes. So I didn't know that for the longest time.
Yeah.
But yeah, important to note, I think.
Totally. Yeah. There's better benefits if you don't have your glasses on or your contacts. Sunglasses absolutely can't be on, right? Because we're not going to get that full spectrum of light. And then same thing with looking through a window. We're not going to get that full spectrum, right? So it does require you to go outside. You don't want to look directly at the sun. That's not good for our eyes either, but you're looking in the direction of the sun. And when you're outside midday, getting skin exposed to the sun.
Yep. So no phones first thing in the morning.
No phones if possible. Yeah.
Yeah. Yeah, I just had a question about where you're located. So you guys are in Mission in Calgary. So that's at Nirvana Health Clinic. I'll provide that information in the email when I send the recording. So there'll be an email, just where to reach out. I believe you guys are still doing the consult calls, right?
Yes. Yeah.
Yeah. Yeah, so I'll have all that information in there for you guys if you want to reach out. Okay, there's 37 questions. I don't think we've ever had this many questions, so we might not be able to get to all of them, but this is awesome. That's great. Great engagement. All right, so will rose hips boost vitamin C? I guess which would be good for cortisol, but
yeah, so vitamin C can be really, really helpful for the adrenal glands to secrete cortisol properly. Rose hips, probably not my favorite to increase vitamin C. We usually use rose hips in a tea format. It can be a really nice aromatic tea. There's no harm in taking rose hips. There's just other options that are much better at increasing your vitamin C. Leafy greens, kale, broccoli, cauliflower, those have much more vitamin C than you're going to get out of rose hips. So I usually recommend getting it more from a vegetable source.
How can menopause affect high blood pressure?
So with the cardiovascular effects, it has been shown that estrogen can bind the blood vessels and actually help to open them up, so decreasing blood pressure. So it's very, very common to see increase in blood pressure in menopause, where with that estrogen dropping off, we can actually see that there's an increase in blood pressure. It is normal as we age for our blood pressure to increase slightly, but if you've seen a really big jump in your blood pressure since going through menopause, or if you're in that kind of perimenopause stage, that's something that's worth having monitored and potentially having treated.
Okay, so not sleeping until 4 a.m. I've tried magnesium, chamomile, lemon balm, melatonin, not working. Any suggestions?
If sleep hygiene isn't a part of your routine, that's super, super important. So decreasing screens at bedtime, especially after the sun is set, if you can get screens out of there. That sunlight exposure protocol that we just talked about, that can be extremely helpful for sleep. Getting sunrise sunlight exposure really helps to retrain that circadian rhythm that allows us to secrete our melatonin properly at night. So if that's a big part of why there's dysregulation in getting to sleep, that can be super, super helpful. And then getting that sunset exposure too, where you're actually seeing the sunset in the horizon, can be extremely helpful at training our bodies to understand that this is the time to wind down, fall asleep. If there's concerns with the fact that your mind might be ruminating and that's why you can't get to sleep, things like phosphatidylcholine or L-theanine can be helpful for that, which those generally are found in supplement form. That can be something worth trying to see if that can help. And sorry, I shouldn't have said phosphatidylcholine, I meant phosphatidylserine. That is the one that really helps us with winding down and can kind of help shut that brain down. So those are some things that might be worth trying.
Yeah, there's a brand, or sorry, the product's called Cortisol Manager.
Yes.
Yeah. I use that one at night and it's great.
Yeah.
Yeah.
Yeah, and that one has, I think, the phosphatidylserine.
Yeah, L-theanine, Magnolia, and ashwagandha.
Nice. Yeah, magnolia and ashwagandha are two herbs that are great for that. And ashwagandha has really good research on some of our female hormones as well. So it can help with some of those menopausal symptoms too sometimes. It's also got some good effects on just decreasing that cortisol. So that's why that product is called Cortisol Manager. But it can be really, really effective for some women at night.
Mm-hmm. Yeah, and just going back to kind of that sleep hygiene piece, just because I've struggled with insomnia, so I have tried all the things.
Yeah.
But yeah, especially at night, I think even just the overhead lights, like, we're told not to look at screens and phones and things like that. But, as soon as the sun kind of sets, we should really try to avoid, just a bright blue light. So even changing your light bulbs
Totally
can make a huge difference, or really low, dim lighting, things like that. Have helped a lot. And even, like the sleep hygiene, it's amazing, especially for women in menopause, but a hot room or a cold room can make all the difference for sleep, right? Yeah.
Yeah, absolutely. So making sure that the room is cool, dark, and no overhead lights after that sun sets. And the mechanism there, which makes a lot of sense when we think about it mechanistically, is that when we have overhead lights, they hit the receptors in the bottom of our eyes, which that's what happens when the sun is out at midday, when we're supposed to be our most alert. And so if we've got overhead lighting, our body doesn't know the difference. We're going to hit those receptors that are at the bottom of the eye, and then we're going to feel that we need to be more alert. So our cortisol can be secreted again, which, decreasing that overhead, your body is understanding, okay, the light is hitting me closer to the back of my eye, and it's time to wind down for the night.
Yeah, absolutely. How long does menopause last, and do hormones ever go back to normal?
So menopause is for the rest of your life. Your levels will drop, and it is normal to have low estrogen and progesterone after you have stopped menstruating. Our ovaries only have a certain amount of reserve. So once we've finished ovulating all of those eggs, we will stop. And then we are technically in menopause. With perimenopause, that big fluctuation in hormones that we can see before we're into that full-blown menopause, that can last up to 4 years for some women. Most women, it's about 1 to 2 that will see that big fluctuation. Some women, it takes them a long time to get into that technical menopause because they keep having a period 8 months apart or 9 months apart. And so they think they're almost at the kind of finish line of no longer having a period, and they'll all of a sudden get one. So for some women, it does last a bit longer, but the menopausal symptoms and the big fluctuation in hormones, 3 to 4 years is probably average, but we see some women that experience them a lot longer.
So what can we do to support the women in our lives at home and work who are going through these changes?
If they're open to talking to you about different suggestions, you can definitely talk about some of the different things that they can add into their diet and help with stress mitigation and helping to support them through the changes that they're experiencing. I would recommend that they go see a practitioner to get things looked at to see if there's anything that can be done to help support them a bit further. But if we're focusing more on that kind of diet, lifestyle, decreasing stress or some stress management, so being there for them, talking to them, making sure that they're sleeping well, practicing those sleep hygiene, getting some light exposure can be huge. So if you're at work with some of these women, taking them out for a walk midday can be super, super helpful for some of these symptoms. And then talking to them about that light exposure in the morning and evening can also be really helpful.
Yeah. Yeah, I think, so after reading this book, if you can see, the Hormone Repair Manual, she talks about kind of the evolutionary piece of menopause, and it just kind of gave a different light because it's so negative and there's such a stigma. So it was kind of nice. It was, how to like embrace, and as we're going through these changes, to look at it in more of like a positive light. So I found that helpful because I know I'm nervous about it, thinking, oh my God, like I don't want this to happen, and trying to avoid it so much is almost making it more stressful. So I think just, maybe having support groups or talking to more people about it, and seeing it in a more positive way.
Totally. Yeah. And potentially reading that Hormone Repair Manual by Laura Brydon. She's brilliant. And I really like that perspective that you just brought up, Leanne, in terms of less on the negative and more of kind of a celebration, right, of this transitory period that we all go through.
Yeah, absolutely. Okay, there are so many questions. That's awesome though. Yeah, unfortunately, we're not gonna be able to get to all of them. I saw a few, or a lot of them were, I've tried all the herbs for sleeping, and I've done all the sun exposure, and just through I'm not going through menopause, but I think this is where getting further testing and speaking to a practitioner is makes such a huge difference, because like you said, there could be underlying infections, mold exposure, endotoxins, things like that, that are just constantly there. And you could try all these things and you might not get better. So yeah, getting the right testing done can just, even though it can be a little costly up front, but it's just so worth it, because these things can go on for years and you're kind of going in circles and wondering what's going on, kind of pulling your hair out, like, as to why you're having all these symptoms. But so just from my personal perspective, I think it's really important, menopause or not, just if you are struggling with a lot of these things, there could be lots of other things going on behind the scenes. So
Totally. Yeah. Yeah. And when we're thinking about kind of all those diet, lifestyle factors that are super important to have in play for this long term, we still, at the end of the day, if there are these symptoms that are still happening, we've got to look a little deeper to figure out why, and then hopefully start to target that, right? Once we've uncovered the why or that root cause.
Yeah, exactly. Yeah, sorry guys. Couldn't get to all the questions, but thank you again so much, and hope you guys all have a great night.
Thanks so much, everyone. Take care.